In this episode, I welcome Wailua Brandman, who is a pioneer of psychiatric mental health nurse practitioner in Hawaii. His contribution as Psych NP was recognized well in the community of Hawaii, and he received Best of Honolulu Award every year from 2015 to 2024. He received Distinguished Alumnus Award from Yale University School of Nursing in 2021. He is also a fellow of American Association of Nurse Practitioners. He received so many awards and honorary positions for his dedication to nursing in the United States. In this episode, Wailua will talk about what Psych NPs do, what he does as Psych NP in his own practice, pros and cons of being Psych NP, and so many more. He will also talk about some advice on nurses who are considering of becoming a Psych NP someday. So sit back, relax, and enjoy my conversation with Wailua Brandman. Aloha, I'm Miki Miura, a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years, and I absolutely love being a nurse practitioner and the lifestyle that Korea has given me. My passion is mentoring nurse practitioner students and new grad nurse practitioners to build amazing careers so that they can have the freedom of choice on what they want to do and how they want to live. All right, let's get into it. Thank you, Wailua, for joining this interview. I'm really excited to talk to you.
Thank you. I'm glad to be with you.
So Wailua is the pioneer psychiatric mental health nurse practitioner in Hawaii. He has so many awards and honorary positions. He'll talk to you about what's it like to be a psychiatric mental health nurse practitioner, how you can be great psychiatric mental health nurse practitioner. So this episode will be full of tips and wisdoms. I want to jump right into the first question, Wailua. Yeah, tell me about your brief introduction.
I'm Wailua Brandman, and I'm a psychiatric mental health clinical nurse specialist and nurse practitioner, both adults, because when I went to school, there was not the family, it wasn't oriented the same way it is today. I graduated from Yale University School of Nursing in 1994. And at that time, the program was divided into child and adolescent and adult psychiatric mental health nursing. The nurse practitioner had established in psychiatry in that period. The program prepared me to be a clinical nurse specialist. In those days, it was thought that a CNS was acute care and an NP was primary care. When I finished my master's degree, my specialty attracted consultation liaison nursing. Now, I had 25 years prior to this as an acute care generalist, working in emergency rooms and intensive care units, newborn nurseries, infants, neo-ICU, special infant care, pediatric intensive care, burn units, cardiovascular intensive care, recovery rooms, emergency rooms, respiratory intensive care, you name it, I've been in acute care.
Wow, it's a lot of experience.
Yeah, so in my mid-40s, I was thinking, I can't work another 20 years in this intense physical activity. So I wanted to go to psychotherapy. I wanted to be a psychotherapist. So while I was at Yale, I developed independent study. And so I created this curriculum to be focused on the APRN as psychotherapists. And I had a psychotherapy tutor, and I had preceptors, West Haven VA, Halfway House, which is for dual diagnosis patients, mental health disorders, and substance use disorder. And I also had a preceptor at the mental hygiene clinic at the West Haven VA. So I did individual therapy and family therapy, couples therapy, as in addition to the group therapy that I did with the Halfway House. While I lived in New York City in the 70s, I also did a training analysis, doing my own analysis, the Jungian analyst, who had been a the famous psychiatrist. So I have a background in Freudian psychoanalysis from Yale, as well as Jungian psychoanalysis from my training analysis with the Jungian analysis. I also worked for 2 years inpatient in psychiatry, adult hospital in New York City, as well as working with adolescents at the Yale Psychiatric Institute just before starting graduate school at Yale. Yeah, so that's my educational background. Oh, I have a Bachelor of Science in Special Studies in Psychology from St. Francis College in Honolulu.
Wow.
Another program that I created my own curriculum and studied therapy and the psychology of women, psychology of users, social psychology, group psychology, abnormal psychology. I even developed a research project for my bachelor's that I developed a testing tool called the Brandman Self-Image Inventory, and that measured the professional self-image of registered nurses. And I tested 75 nurses at Jamaica Hospital in New York. And then the semester I never analyzed the data. So that's a research project that's still waiting to be completed, actually.
Wow. There are so many things that I want to unpack. First of all, I think it's very empowering to hear that in your 40s, you decided to go back to school to become an APRN. And then first you became a CNS, as a certified nurse specialist. Then later on, nurse practitioner. Some audience in 40s or 50s or later in the life, I don't want to say later, to be honest. It's maybe middle in the life, rather.
Well, that was 25 years ago, so now I am later in life.
But some people wonder, is it too late to go back to school? And I hear that from my colleagues from Japan, because ageism is pretty strong in Japan. And some people feel like, I'm in 40s. Would I be ridiculed, or is it too late? And stuff like that. So it's very empowering to hear that you enter a grad school in your 40s with abundance of different clinical experience and everything.
I think students in their middle years actually would do better in graduate school because they are more focused. They know where they're going. And so it's easier to absorb all of the information that I get. Whereas when I was 18 to 20, I was lost. I didn't know what the heck I wanted to do. And I never made really good grades the first couple of years in college. It wasn't until later on when I decided I wanted to go to nursing school, and I went to a community college and got an associate degree in nursing. After dropping out of college after 3.5 years, you got to know where you're going and what you want, what I'm supposed to.
That's a good point. And actually, there are a lot of nurses who are CNS in Japan. Many of our seeking, considering of becoming a nurse practitioner, because more attention and demand are focused on nurse practitioner in Japan. And I believe that might be happening elsewhere in the world. And tell me about the transition of you first were CNS and then later on became a nurse practitioner. How many years did you work as a CNS?
Actually, when I graduated from Yale, I had quite a heavy student loan debt. And I learned about the National Health Service Corps program where you could work for 2 years in an underserved area and get all of your debt wiped out. The problem was it had to be in primary care. And at that time, a clinical nurse specialist in psychiatry wasn't considered primary care. So I had to get a psychiatric nurse practitioner. So immediately after graduating, I was accepted at one of only 3 psych NP programs in existence in the United States.
Wow.
And the one I got into was Cal State Long Beach. So I was on my way home to Hawaii. I stopped in California for a year and did the certificate program. And halfway through the program, National Health Service Corps changed the rule and said that a psychiatric CNS could be a primary care group.
Oh,
Anyway, the program at Long Beach was specifically geared to prepare an advanced practice psychiatric nurse to provide primary care to a psychiatric population. So that was great. That was exactly what I wanted. I get to finish the year.
Mhm.
And when I came home, there were no jobs available for mental health and psychiatric NP. There was only OB, GYN, and dental. There was no job for me here. Nobody knew what a psych NP was. So basically, I had to change the culture. And I pioneered the role of a psychiatric
right.
practitioner. I went to the Hawaii Nurses Association and I kept pressing them, when is the next meeting for advanced practice? And they said, call back next month after month, call back next month.
Oh,
So finally they said, why don't you be the chair of the Council on Advanced Practice? She said, okay. I went in, scoured the books, found out the names and phone numbers of all the clinical nurse specialists and nurse practitioners that had been active in the Hawaii Nurses Association. And I started calling them and inviting them to come and meet with me at HMA. So we began meeting again and developed bills to take to the legislature. And we began developing relationships with legislators. In fact, we wrote the Nurse Practice Act. There hadn't been one until the time. And I had taken a course at Yale regulating healthcare providers at the Yale Law School. And my faculty person was Barbara Safrit, who wrote that seminal article, Healthcare Dollars and Regulatory Sense, that promoted curing, if you will, curing the healthcare crisis by using advanced practice nurses to provide quality care to population. So Barbara Safrit was my faculty. So when I came home, understanding of regulation of healthcare providers, and so we began to pass bills in the legislature that established regulation of our profession. And then in 2011, I introduced a bill that required all hospitals to allow APRNs to practice as primary care providers and to bill insurance as such.
Wow. And nurse practitioner in Hawaii, including those in a psychiatric mental health field or any other field, really, we owe you. You paved the road for us, that we have a full practice authority. And now even I graduated 10 years ago and I've been practiced for 10 years. Even during that short period of time, I realized many more nurse practitioners are working at major hospital nowadays. And you had such a long experience, and I'm sure things changed, but it wasn't just things happen. You actually had it to move the needle. You had it to do everything. Thank you so much for the work, and we really appreciate you. That very lucky to be able to work in the state, but it didn't happen without your hard work and other senior nurse practitioners' hard work, for sure.
So the bill that I'm talking about that I introduced in 2011, it progressed through all the committees. And then in the final committee, Senator Baker amended the bill to move regulation out of the Board of Medicine into the Board of Nursing, to remove all of the language in the statutes that said that we had to have relationships with physicians. And so all these changes to the bill, all these amendments to the bill went through, passed the committee, went to the governor's desk, and he signed it into law. And that was the point where we became a plenary state. We had this authority at this point, including prescribing controlled substances.
Amazing. That's a very, it's a history lesson.
Yeah.
Now, I want to ask you, so you became CNS and because of the wrong repayment situation that you had to go back to school right away, you think that the learning to become a CNS but you end up practicing as a nurse practitioner. So it sounds like you haven't really practiced as CNS, but do you think that was helpful to be a CNS first, then become a nurse practitioner?
Absolutely. And in fact, I did practice as a CNS before the state ever recognized psychiatric nurse practitioners. I worked at the Kaneohe Care Cottages, which was a housing unit on the state hospital grounds, the transitionary housing. So I was a clinical nurse specialist there. And then I also worked at Queens in their short-lived psychiatric urgent care as a clinical nurse specialist. And then the first job that I had as a psych NP was for Care Hawai'i at their community-based case company, Care Hawai'i. And so I was actually recognized there as a psychiatric practitioner. So that's the first job as a psych NP, and that's where I actually pioneered the role. After that, then various agencies began to hire psych NP. And once we got plenary authority in 2011, the numbers of APRNs in Hawaii tripled. All of a sudden tripled because people knew that they could come here and practice to the full scope.
Yes, and that's such a big deal. So can you give me more specific examples, like what was helpful for you to first become CNS or what you learned in CNS program was helpful when you become nurse practitioner?
To understand what happens to a psychiatric patient beyond primary care. When psychiatric patient, when their condition deteriorates, when they decompensate, when they have to be hospitalized, when they don't adhere to the medication regimen and they decompensate, what's that like? How does a psychiatric nurse practitioner incorporate that knowledge into the care that they give in primary care? Now, these days, psych NPs don't practice the way I practice because they haven't got that CNS. They come in and they're taught, they're not really taught to do psychotherapy. They get an overview of psychotherapy, but they're not trained to do any particular modes of therapy. And I do many modes of psychotherapy. They're primarily trained to do medication management. And so when students come to me and they're precepted in my program, they're amazed at what I do because it's not what they've seen in other preceptors' practices. They just see a much fuller.
So let's talk about, so you mentioned about you do psychotherapy, med management. So tell me about, for folks who have no idea what psych NPs do, could you explain what you do and what kind of disease conditions you see in your practice?
When I was at Care Hawai'i, mainly I was seeing schizophrenia and bipolar disorder. And every now and then there'd be an odd patient like me, someone with Huntington's chorea, or a lot of it's been major depressive disorder that was misdiagnosed. Actually, a patient who had bipolar disorder. Other practitioners missed the diagnosis, and so they were giving inappropriate treatment, and patients were improving.
Right.
Or they switched from depression. So in my current practice, I see a lot of bipolar disorder, and I see patients who have substance use disorders, and I in the past seen a lot of sex offenders who also have bipolar disorder. More recently, I have seen as many of those types of patients. I see geriatric patients who have anxiety disorders and depression. see a lot of people with dysthymic disorder that often that's a chronic low-level depression that often starts in child. I see a lot of attention deficit disorder is comorbid with bipolar disorder or with an anxiety disorder. I see obsessive compulsive disorder patients. Yeah, I see a full gamut of disorders.
Do you focus on adults, or I think you mentioned that when you receive education, your program was more focused on adults?
My certification, NCC certification, has always been an adult clinical nurse specialist, an adult nurse practitioner. So I'm still currently dual certified.
Wow, amazing. So you do med management, psychotherapy, and actually you own your own practice.
And I also do primary care. So I think that's very important. So I monitor my patients' full health picture.
Wow.
A review of systems at every session and look at their medications at every session and do supportive psychotherapy when we have a half-hour session. And when we have a full hour, then I do more in-depth psychotherapy. And we look back at their upbringing. We look at social environment, their spiritual environment. Yeah. And if they have this physical medical issue that I can't deal with, I make sure that they're hooked up with someone who does treat them. I don't treat blood pressure. I don't treat diabetes. I monitor it. I know what's going on with it and refer them to somebody who does treat it.
Just to have that perspective is so make you unique, and then also make Psych NP unique from other mental health providers, because especially in the United States, there's so many different kinds of providers who provide mental health care, like psychiatrists or psychologists, or I don't know if you call it case management, but psychologists, they focus on psychotherapy, they don't do med management, and psychiatrists, I believe, because they tend to go right straight into the psychiatric residency, I'm seeing a lot of psychiatrists feel very uncomfortable with any slight primary care issue. So I think their attention is more in a specific psych mental health field, but you have such a broad perspective of seeing this, and that's also nursing too, that you're seeing a whole person, not just the mood and stuff like that, but you're seeing whether this medication, the other medication that the person is using for other non-mental health disorder, but is it affecting the person's mood and stuff like that. So that's a very valuable perspective, I believe.
Yeah.
Wonderful. And how is it like to have, how many people are at your practice, or you're sole provider and an owner, and you do receptionist and insurance and everything on your own?
I do. Yeah. Now, in this office suite, there are three of us, and we're all on the lease, and we're all solo providers. There's a master's prepared mental health counselor, and there's a marriage and family therapist, and so I'm really the only one here that's doing med management. We all do psychotherapy. I do primary care. I own my own business. I have S Corp, which is also a limited liability corporation. And I have a biller, does my billing, follows up on insurance denials and all. Yes. And then I have an accountant as well who does my payroll. I'm the only employee of this corporation. And they also do my taxes. That's how I organize it. I answer all the phone calls. I screen all the patients. I do everything except
Wow. And that sounds a lot. And yeah, it just sounds a lot. So wonderful. But you have such a very diverse perspective, from legal perspective to business, and then also this your specialties, psych mental health. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Now, I want to go back to the point a little bit that when you came back to Hawaii after becoming a nurse practitioner, there was no job available. And especially folks outside the United States, they may face similar problems. The nurse practitioners, still the profession is developing, and they will probably face the same problem. There's no job. There's a need, but there's no job because you are the first case, you are the pioneer. How did you create a job?
How did I create a job? Let's see. The first job I had was with Aloha Care, a Medicaid insurance company. And they had just made a carve out of mental health coverage. And so I was the first case manager. I was a clinical nurse specialist and certified as a CNS. And there was no certification exam yet for psych. I was hired as a Psychiatric CNS, and I was a case. And that job was so micromanaged, I couldn't tolerate it. I left before 1 year. And there was a grant program that was starting at the University of Hawaii that was combining a psychiatric clinical nurse specialist with a primary care NP. So they recruited me to be on a curriculum. And so I kept telling them, you need to do a psych NP program. And they knew it. And so then when the program was getting started, then they hired me to group teach a health assessment course. Now I was fresh out of graduate school, and they wanted me to teach people how to do physical exam, not mental health. Being a man in a female-oriented profession, I was bullied. That was really toxic. I renewed my contract at the end of the year. So that wasn't a very pleasant. I certainly learned a lot of it. That's when I decided I was not going to work for another corporation. I sought out first, before I could do psychotherapy in the state, I had to clean up something in the psychology professional title of Hawaii Administrative Rules. They said that only a psychologist with a PhD could advertise that they did therapy and that they were psychotherapists. I had to bring forth the preparation that advanced practice nurses and psychiatric nursing were educated doing psychotherapy. And so we got that all cleaned up, and then we were able to say that we did psychotherapy, although we couldn't claim to be a therapist. That was a protected title in the psychology rules. So I sought out a social worker with office space, and I began to rent a room in her office on an hourly basis. And a week after I started, I had brought in enough clientele that I could pay half of her rent.
Wow.
So it didn't take long because there's a great need for...
Right. Yes.
So that's basically how I started. I did all of the insurance claims by hand.
Wow.
We didn't have electronic health records. Yeah, my notes were all handwritten notes. It was like the archaic antiquity almost. Yeah, so we've come a long way since then.
Wow.
That's how I started the company.
I think that story is very helpful for those who not intentionally want to be a pioneer, but have to because there's no other examples before them. So that's so helpful and valuable story. So you touched this a little bit. The next question will be like, are all psych mental health nurse practitioner work same as you? And then you mentioned that no, they don't, especially the newer psych mental health nurse practitioners or even older, more focus on the med management rather than the psychotherapy. So psych mental health nurse practitioner students, do they learn psychotherapy or is it mandated in the program or that's option?
Like I said, educational programs, they're just given it over. They're not really schooled in any individual therapy modality. And the one that they probably get most exposure to is cognitive therapy. Their practices like generally depends on if they're an employee or if they're in private. If you're an employee, you have to do what an employer says you have. And they generally want you to do med management because they have other providers who don't have to pay as much to do therapy, like social and counseling. Now, if you're in private, you can pretty much do whatever you want to do.
Wow.
I encourage my students to go into private practice. And when I screen prospective preceptees, I ask them, what do you want to do when you finish school? Do you want to work for somebody and do just med management, 10-minute sessions? Or do you want to actually be a provider for these patients, really have a relationship with them and help them and be a cheerleader for them, encourage them to their lot in life, or you just want to push bills at them? It's up to you.
That's amazing because I work in women's health and I encounter some patients with the psych mental health disorder, and I work in the largest federally qualified health center. So we do have behavioral health departments. We have a lot of psychologists, some psych mental health nurse practitioners, some psychiatrists, but a lot of psychologists. So usually the psychologists see those patients first. Then they get sorted out to whether the patients need to see psychiatrists or nurse practitioner. And my struggle sometimes as a primary care provider is psychologists see patients and they say, okay, it seems like this patient can use antidepressant. Can you prescribe? But for me, I'm specialized in women's health, but I'm not specialized. I didn't receive, especially I'm family nurse practitioner, but I didn't receive any psych mental health education during grad school. So I felt very inappropriate to just throw medication. There's a disassociation between the psychotherapy and the medicine. And I'm just really hoping that it seems like there's not much communication between psychologists and those psych mental health providers who can prescribe medicine. And then they rather ask PCP to prescribe medication, but the PCPs are not specialized. And that's why we refer patients to. So it just seems like that's why I'm very big fan of psych mental health nurse practitioner, because you guys can do both. Guys can do everything. And that's what I actually want for my patients, because I think you can't just throw medicine without actually seeing, is it working? And then how to assess the response to the medicine. I think for that perspective, I think Psych NP is so wonderful because you guys treat as a whole for that psych mental perspective.
Yeah,
so
I wouldn't say that we all do.
So who would be a good person to become a psych mental health NP?
I think the most successful recruit to become a psych NP would be someone is very sensitive, very sensitive. Someone can see deeply into another person's life. A lot of what I do is pattern recognition. And I think a successful psychiatric nurse practitioner needs to follow one or more nursing models that speaks to them. So the models that speak to me are Margaret A. Newman's Help Us Expanding Consciousness, nursing. She's a theorist. Jean Watson's Human Science and Charity. Now she calls it Caring Sciences. Martha Rogers, Integral Human. My mentor, Barbara Dawsey, Integral Nurse, is a grand nurse. Besides the nursing theorist, my practice is also framed in the holographic paradigm. I also do mind-body medicine. I do a practice called holographic memory resolution. That's a trauma involving the visualization of color passing a person's body. Metaphors in the body that represent memories of trauma that's not been resolved. So the holographic paradigm is really important. Systems is really important to realize that we're all part of a network of energy that unites all of us. We're part of an energy network, all of us. That's important too. Students need to want to expand their consciousness, to learn throughout their career, throughout their life. They need to want to learn more and apply that knowledge to the benefit of the earth. And we're here to improve the quality of our experiences, being the world a better place. We're finished with our practice of living. Does that answer your question?
I think the question was broad, and I was thinking about who will be good to become family nurse practitioner. It's a difficult question to answer. So I'm just going to move on to the next one. But I was very interested.
So I think that each individual needs to consider, am I an appropriate candidate to become a psychiatric nurse? And I think it's up to each individual to make that.
There's no one type, like you have to be this way or that way, and then just one stereotypical or like this type person will be perfect.
I think it would be easy to get burned out depending on what you like to see. So I think that's really an important consideration.
Now, what are the pros and cons of being a Psych NP?
One of the pros for me is the amount of gratifying patients, the amount of grateful patients who express their gratitude on a basis. That is just so heartwarming. Moves me to tears almost every single day. That I make such an important difference in individuals' lives. That one of the cons is that deal with the broken healthcare system. The insurance company's micromanagement of healthcare is just atrocious. Really tragic.
So Wailua and I are in the APRN policy committee that we discuss different regulations in Hawaii that affects how APRNs, including nurse practitioners, practice in the state. And because you own your own private practice, whether you get reimbursed directly affects business, meaning that if you cannot sustain business, the patient will be on the street, have no care. So this is not just to sustain business, but to serve the community. And this is extremely important, especially for small business. I hear that all the time, and I can see that how it can be a con. What kind of nursing experience would help to become a great psych mental health nurse practitioner? You have a bunch of different experience, and maybe some people want to go back to grad school sooner than 25 years later. But if they can pick and choose, so I want to be a psych mentee down the road. I just graduated from nursing program, and I want to have some nursing experience before go back to grad school. What would you recommend for that person?
A lot of times, nurses in academic settings will advise students to work as a med-surg nurse first before you go into psychiatry. I don't think that's all that necessary. I think if you want to be an advanced practitioner in psychiatry, you know that beginning that you probably would benefit by working in generalist positions in psychiatry, like a case manager position, inpatient staff nurse in psychiatry, work with adolescents, also work with adults, and also geriatrics. Now some geriatric psychiatrists, dementia patients, memory care, working in generalist positions in some of those areas to get a flavor or a taste of what it's like to work in psychiatry. And a couple of years doing that or more until you really feel you're confident that this is what you want to do. Yeah, there's so many different areas in psychiatry, in nursing in general,
Right.
from informatics to research. So many different industries in the medical industry, like pharmaceuticals, durable medical equipment, sales, development, just the potential of the possibilities.
That's such a great point. Would you recommend nurses to get acute care experience before going to psych mental health NP program?
Only if that's their desire. I was an ER nurse for so many years because I really thrived on this. You never know what's going to come in the door, and that excitement, that stimulus, that really excited me. My very first job in the healthcare industry was orderly. You ever hear that?
No.
Nursing assistant, men we call orderlies.
Oh, interesting.
We weren't nurse aides, orderly. So my first job was an orderly in a 400-bed hospital on the graveyard shift. So I was based in ER. The excitement of being in, never knowing what was going to come, that kept me in acute care for a long time. Now, shortly after graduate from nursing school with my associate, I did work in Houston, Texas, in an intensive care and cardiovascular. And during that time, 90% of the patients who come out of the operating would be having a transient psychosis, paranoid psychosis. And they think that someone was trying to kill them. They had actually just been killed in the operating room. And their chests were broken open. Their heart stopped. They were put on a heart-lung machine, and then they were brought back to life. And so they came out like they'd been in this dream where someone was trying to kill them.
Wow.
Right?
That's fascinating, actually.
So that really fascinated my mom. And I started studying dream analysis.
Wow.
So it's really individual. Acute care, the med-surg, and all that stuff, informatics, whatever you're fascinated by, you should do that and do it first. And then if it's psych that fascinates you, do that first. Thinking that there's something other than what you're tuned into.
Great advice. Lastly, any advice for NP students or nurses who are thinking of becoming psych NP? Any advice for them?
I think that if you want to become an advanced practitioner, you first need to think about a doctoral NP program, because the culture now is pretty much demanding that if you don't have your DM, you need to get it. So if you're going to go to graduate school to be an APRN, you probably ought to just start in the NP program and do it all and get it done. I did the master's program because that's all that was available at the time. And my faculty frequently tell us that the work that you folks are doing is doctoral work. But the number of credits to be given a doctoral degree, there just isn't one that in existence other than the PhD. And The master's degree was the terminal clinical degree at the time.
Mm-hmm.
And then once I got out into practice, I didn't really want to go back. I didn't start until I was middle-aged, right? You see DNP students older than I was.
Mm-hmm.
That would be my first bit of advice. If you want to be an APRN, just go for the doctoral program. And if you want more experience before you start the doctoral program, great. That's great. You need to have a mature mindset when you go into the DN or doctorate of nursing science, even a PhD program. You need to be well-disciplined, be able to focus. You need to know where you're going, what you want to do.
Yes, for sure. I remember when I first got master's degree, became a nurse practitioner and practiced a few years. And when I decided to go back to DNP, my supervisor, who is also a nurse practitioner, asked me, are you going to use your degree? Because she was thinking for me that don't go to school just because. Go back to school if you're going to actually do something with the degree. And for me, it worked because I wanted to eventually teach. I'm not a professor, but teaching in different ways now, and definitely getting a doctorate. And then also learning about politics and stuff like that. That was very helpful. But yeah, that's so wonderful. Thank you so much for sharing your wonderful stories and wisdoms. Hoping that we can do another session with your students very soon. And at the time, we'll focus on more like clinical training, which I have so many questions to ask about.
Great. And one additional thing I'd like to say is when I precept, they don't just sit around and watch me. They do the work. And I watch them. And I coach them and I critique them. And I teach them additional stuff that they didn't maybe approach during the session or the patient. I think that came from my experience as a graduate student at Yale, when I was just sent off to see a patient and do the work and then come back and tell the supervisor what I had seen, what I had done, what were my thoughts, how did I put it all together, what was my critical thinking in working with this patient. And so that's what I want most people.
100% agree. I let my students, first day, orientation, second day, you go for it, because you can't just learn from just watching. You have to feel the responsibility, and you have to make mistake on your own. You have to make decision on your own. And they're seeing a lot of things that you can't learn without actually experience on your own. So very good point.
One of the most important things I teach my students is you are not going to kill this patient. Stop worrying about it and just be present with the patient.
Excellent advice. Thank you so much, Wailua, for sharing this.
I'm having a great time with you.
Thank you.
And I appreciate you asking me to be with you. Thank you.
I hope you enjoyed this episode. Please give me a thumbs up if you like this video, and don't forget to subscribe to my channel. I upload a new episode every Friday. Also, please comment any questions or requests for future episodes. Alright, I'll see you in the next episode. Aloha.